All right, let's talk about back pain, neck pain. If you've ever had it, you know that frustrating search for the fix. We're always trying that one magic stretch or, that special supplement, just hoping for some relief. But what if the real answer isn't a quick trick at all, but a system? Let's dive into the modern scientific way to actually get your spine healthy.
So, what is the real secret to a healthy back? I mean, seriously. We see all this conflicting advice everywhere, right? Do this, don't do that, you gotta buy this new gadget. It's enough to make your head spin. But the truth is, the real solution is actually simpler in its logic, but, and this is the key, it requires way more than just one single action.
See, it's not about finding some magic pill. It's about understanding a system, a real professional rehab plan. It's not just a random collection of exercises thrown together. No way. It's a structured, scientific journey, one that's designed to guide your body from injury all the way back to full function. And honestly, just understanding that journey, that's the first real step to taking back control. Okay, so this whole journey is built on a really clear three-phase framework. And these aren't just some random stages someone made up. They're directly tied to how our body's tissues actually heal. And that's what's so cool about it, because it ensures you're always doing the right thing at the right time. This table right here, it lays out the roadmap perfectly. Okay, so first up, you've got the acute phase. This is all about maximum protection. We're just trying to control symptoms, get through the day. Then you move into the subacute phase. We start to dial back the protection a bit and begin returning to some normal activities. And finally, you hit the chronic phase. Protection is minimal, maybe even none, and the whole focus is on getting you fully back to work, recreation, sports, the whole shebang. You see how it just logically builds on itself? It's a process. Okay, so where does this whole journey actually begin? Well, it all starts with one single core principle that is the foundation for absolutely everything else. And get this, it's not about strength, it's not about flexibility, not yet anyway, it's all about awareness. The fancy term for it is kinesthetic awareness, but really all that means is your ability to feel where your spine is in space and control its movement safely. Think about it. When you're in pain, that connection between your brain and your back gets, well, it gets fuzzy. It's like a bad phone signal. The pain messages are just interfering with everything. So this first step is all about retraining that communication pathway, clearing up the signal, and making that connection conscious and super clear again. And how do we do that? Well, it starts by finding what's called your position of bias. This is basically your unique posture, your sweet spot, where your symptoms are minimized. You can think of it as your spinal safe zone. Learning how to find that position and just hang out there, that is the very first skill you master. And it becomes the stable, solid base for every single exercise that comes next. All right, so once you've built that solid foundation of awareness, what's next? Now we start to gently unlock movement. The focus shifts from just being stable to carefully, and I mean carefully, restoring your natural range of motion. And there are a bunch of different tools in the toolbox for this. Self-stretching is a huge part of it, for sure. But this phase can also involve a pro stepping in with techniques like joint manipulation or even traction to get at those really specific restrictions. The key here is that these aren't just random stretches. They are targeted ways to improve flexibility exactly where you need. And this quote, wow, this is so important. This clinical tip from the source material is just such a powerful reminder that more is not always better. Trying to stretch into tissue that's already inflamed and angry, you can actually do more harm than good. And that right there is why professional guidance is so crucial. You need someone who knows what to stretch, when to stretch it, and maybe most importantly, when to just back off. Okay, so we've got our awareness down, our mobility is starting to improve. Now we get to the powerhouse phase, building real strength and stability. And I absolutely love this analogy. Think of your core muscles as a protective inner corset that literally supports and stabilizes your spine from the inside out. How cool is that? Now this is not your typical gym workout. We're not talking about endless crunches here. Stabilization training is super specific. It's all about learning how to turn on and control those deep, intricate muscles that wrap right around your spine. These are the muscles designed to brace you against everything life throws at you, whether you're lifting a bag of groceries or literally just getting out of a chair. So to really get this, let's break down these two different muscle systems. Over here on the left, you've got the deep segmental muscles. Their whole job is stability. Think of them like the concrete foundation of a skyscraper. Now, look at the other side, the global muscles. These are the ones we all know, right? Your six-pack abs, those big back muscles. Their job is movement. They're like the giant crane that sits on top of the foundation, doing all the heavy lifting. Stabilization training is all about making that foundation rock solid first. Because, what good is a powerful crane on a shaky foundation? It's a recipe for disaster. So, how does this actually work in practice? Well, it's a really logical progression. First, you find that neutral spine we talked about. Then, you learn to gently, and I mean gently, activate those deep stabilizing muscles. A common cue is that drawing in maneuver, like you're gently pulling your belly button towards your spine. Only then, once that's stable, do you start adding simple things, like moving an arm or a leg and challenging that core to hold everything steady. It's all about precision over power. Brute force has no place here.
All right, this is where it all comes together. This is the payoff. All those skills you've been building, that awareness, the mobility, that deep core stability, we're now going to integrate them and apply them to the real world. The whole goal here is to bridge that gap between what you do in a therapy session and what you do in your actual everyday life.
And this final stage, which we call functional training, isn't just one thing. As you can see right here in the chart, it's this awesome blend of 3 key elements. You've got the stability you've worked so hard to build, your overall cardiopulmonary endurance, and your body mechanics, how you move through daily tasks. It's really about making your body resilient enough for everything you ask it to do. So let's talk about endurance for a second, because it's a massive piece of this puzzle. Things like cycling, walking, swimming, yeah, they're great for your heart, obviously, but they do so much more. They actually help your tissues recover, they increase your body's overall capacity to do work, and they give you this perfect opportunity to practice maintaining that good, stable posture while you're moving. It's practice for real life. And this is the real-world application right here. The training gets super specific to movements you do every single day. We're talking about practicing how to lift a box correctly, how to reach for something on a high shelf, how to push or pull a door, even simple things like getting up from a chair without putting all that strain on your back. The whole point is to retrain your body to do these things safely and efficiently, automatically. So after all this, what's the ultimate goal? What's the holy grail of this entire system? It's simple: automatic stabilization. You want to get to a point where your core just turns on and supports you without you even having to think about it. It just happens. That is true, lasting protection for your spine.
So I'll leave you with this one final thought. Your spine is an absolutely incredible structure, right? It's engineered for movement, for resilience. So the big question you have to ask yourself is this: is your daily life, are your habits, your awareness, the things you do every day supporting that incredible design, or are they working against it?